Hi, everyone. Welcome to our webinar, Talking to Your Children About the Coronavirus. This is a webinar that is co-sponsored between Moms Rising and Women's March, and we're really excited to have our panelists with us today. My name is Breedlove. I'm the Chief Strategy Officer for the Women's March, and I also have a 2.5-year-old toddler at home, so I'm actually very excited to be part of this conversation for many reasons. I want to go ahead and take a minute to talk about our panelists and just introduce them a little bit. But first, I want to actually invite people to introduce themselves in chat while we're doing that. So please, in the chat box, if you want, our team is going to be looking at this data, your name, where you're at, and one word to describe how you're doing today. Again, it's really helpful for us, for folks who might not know. We have up to possibly 1,200 people registered for this webinar, so there's a lot of interest, and we're going to be asking a couple of questions because we want information about what if this is most helpful to you, where you are, how old your kids are, etc., for some of our own purposes. So we're going to be doing that part as well. So before we start to jump into it, I want to introduce you to the technology. For those of you who, like me, might not be the most tech savvy, just saying, or for those of you who are old hat at this, I wanted to add a little bit. So this is Zoom technology. Many of you have used it a lot. Maybe some of you have not. You can use the chat function that you'll see right in the down below. To the right of your screen, we see it's already really happening. There's 49 items in it. Already, you can use the chat function, but cannot track questions unless you put it in the question and answer, which is a little box at the bottom of the screen. So we have the group muted because we're so huge today. We're actually going to hear from the panelists, so bear with us if there's awkward pauses, but that's the reason we actually can't verbally hear from other folks, because there's just too many people interested in this topic. The same thing, I want to ask for your patience with questions and answers. We are not going to be able to get to all of your questions today, but what we are going to be doing, because we have our great team present here, is trying to look for patterns in the questions and directing a set of them to our panelists, as well as creating a way for people to process these questions afterwards and sharing some resources that we hope will get at some of these questions. So this call is being recorded as well, and the recording will be sent out as soon as possible after the wrap of this webinar. So if there's parts that you missed or you came in halfway through, etc., questions, we hope that that can answer a little bit as well. So I want to introduce our panelists, and then to just walk you through a little bit of our time together, here's how it's going to work. We're going to finish the welcome, do some framing of how Women's March is seeing this, this political moment and part of what this webinar is part of in terms of the work. We're going to hear from the excellent panel, and we're going to do questions and answers to the best of our ability, and then we are going to close. So that is our plan. Okay, so as I call on you panelists, because we can't hear you, at least maybe you can raise your hand so folks at home can see who we're speaking about. Again, really fantastic level of expertise represented in the women in this panel, and really excited to introduce you to them. So first we have Monifa, Bandele, Senior Vice President, Healthy Kids and Maternal Justice Programs with Moms Rising Together and Moms Rising Education Fund. Monifa, I think people can see you there looking fantastic in the yellow. Secondly, we have Lina Acosta Sandaal, licensed marriage and family therapist and the owner and founder of Stop Parenting Alone. Lina in the red, can you wave for everybody? I know, I feel like I'm making y'all be contestants or something. And last but certainly not least, the Dr. Aletha Maybank, Chief Health Equity Officer and Pediatrician at American Medical Association. Really excited to be able to hear from everybody here today. Okay, and just a note that I see that some of you, there's many chat entries right now. If there are technical issues that are coming up, our team is going to work on fixing them, even if I'm not up here saying that, as they see them. Several of them are actually on this call. You just don't see them because they're represented by the Women's March logo. Okay. So just a little bit about Women's March and where we are and how we are seeing this moment. So like I'm sure so many of you were feeling incredibly both overwhelmed, but also eager to figure out how do we engage in this moment, which is an unprecedented and completely different moment, definitely in the history of this organization, but also in this country. And given the existing and increasing threat of the coronavirus, we understand that so many women in our constituency will be feeling overwhelmed and isolated and not sure of where to turn for tools and support. And we feel like, given, just to give you a snapshot of our size, that, you know, with one of the largest sort of digital footprints of grassroots everyday women activists in the country and the world, we feel like it's our responsibility not to try to act like we're the experts on everything or we're going to be able to do all the work, but actually to use that big mic amplification to find excellent experts like the ones on this webinar today, and to partner with critical groups to do the things that we need to do right now, and to make sure that there's an audience as best we can for not just the marchers and the people in our constituency, but any folks that want to be able to use these resources. Some of you may or may not know that Women's March as an organization is made up of majority new activists. Up to 70% of our more than 1 million constituents are brand new activists. And we also know that many of our marchers are looking to us for help in understanding not only the personal, but also the political implications of this time and how to act, especially in a time of social distancing, where some of the work that we've done as social movement organizations pushing for progressive change are just not possible right now. Mass mobilizations, in-person meetings, a lot of this work. And so we are also trying to figure that out. Do not pretend to have all the answers, but there are a few things that we know for sure in terms of how we're thinking politically about this moment, which we also know is always personal. So one thing we know for sure is that women of all walks of life and lived experience will be on the front lines of this pandemic in many ways. Personally, we do the majority of caretaking for sick, vulnerable, old and young, and folks with disabilities. And we also make up the majority of the workforce in many of the industries on the front lines right now. Some of you all may have seen the New York Times says that flight attendants and nurses are 2 of the 4 most impacted workforces, and there are several workforces. We've done some great other webinars, thanks so much to some of our other partners, about what is happening in these frontline industries where women are actually the ones both losing wages very, very drastically in industries, but also on the front line of risk, right? So we know that that leads to an incredible amount of overwhelm, burnout, and need for support. We also know for sure that we can organize for some basic humanity and fairness and the protection of our homes, families, jobs without sacrificing our principles or communities. So in this moment, we know that it is like the women on this call, women leaders all over the country that are actually saying, wait a minute, yes, it's about my family, but it's also not just about my family. What is it going to look like for us to actually figure out how we're going to meet needs across this country for the public and for everyone. And we also know that no matter how bad things get, there are options about if and how we show up with compassion and a sense of equity and justice for people affected or no. And, you know, every time I'm kind of feeling some kind of way sitting here in my house, I also think about all of the, I live about 10 blocks from a hospital, all the people going in and out, like some of you, like some of our presenters right here, in and out of these facilities, taking risks every day to try to take care of people, to try to figure out how there's equipment, to try to get through this time and provide for people's basic needs, right? And then, you know, another thing that we've really been thinking about a lot as we've been scrambling to shift our strategy, like every organization is right now, is it's really clear to us that part of our role is to continue to harness the power of everyday women activists to hold accountable government corruption and corporate greed when and how they crop up in this crisis. And we literally need the people on this call's support to do that. Some folks don't know because we're such a big brand, they think we're funded by private funders. We're actually not. we're actually supported primarily by marchers. So the kind of organizing we're able to do is dependent on that. And one example I would just give is, you know, we were not the only group, but we were one of the few groups that in the last week really pressured Amazon to say, you need to cap what sellers can sell hand sanitizer for, how much they can inflate it, wipes, toilet paper, paper towels. And one of the things that we said was like, look, you know, this is actually affecting the people who do most of the shopping and buying and need most of these products, which is majority women in the United States. They're looking at empty shelves. They're going on Amazon and they don't have $40 to pay for hand sanitizer. And actually between our effort and the effort of some other groups, Amazon said, okay, we're gonna cap the selling because we understand it actually is pandemic profiteering, right? So we're able to have impact even in this time if we're really specific, we stick together and we push forward on things that folks need. And that there's many examples, there's so many things that need to happen, but there are also very concrete ways that we need to make sure that in this time, we're able to actually do what we need to do for everyday women on the ground, and not this become an example of, again, anyone lining pockets or taking advantage of such a terrible situation. So we've definitely been engaging that a lot. And then we also know that, you know, we believe that given what we understand of the conditions of our time, this is a first chapter of places that we're moving and might be moving in the future, right? And we know that we're in climate crisis. We know that both in immigrant detention, prison centers, et cetera, how the most vulnerable are treated in crisis is going to continue to be an ethical crisis in our time. And we're going to be engaging the question about whether all of our social structures and everything in our public life works for just a few folks or works for everybody. And we know that that has everything to do with also where people are situated in life, in regards to race, in regards to disability, in regards to class, in regards to gender and sexuality. Yeah, and then finally, you know, I think that this question of how women are going to be continually placed in impossible situations with home and work life and shouldering the majority of care work. So as climate and health crisis continue to impact us, we know that that's going to be a really critical part of why we have to build force to be able to move in a particular way. Okay, so we're going to finish up with me talking and we're going to get right to the panel. But a few quick things just in case for those of you who want to stay involved in some of our ongoing efforts, how we're thinking about our role as Women's March and what we can offer. So a few things. One, education and connection. This series of webinars this week and creation of other spaces that fortify us for the road ahead. We also have a webinar on Thursday about how we support and care for our elders, because we know that many of us are parents, many of us are also responsible for elders in our lives, many of us are doing both. And so that's going to be happening. And to give folks a sense, this is our third webinar this week. This is our biggest one, but the first two were each about 400 people. So all of them are being well attended. There's clearly a need. And we know there's also a lot of other great resources people are putting out. We're trying to amp and share that as well. Secondly, and I touched on this a little already, mobilizing our network to demand corporate and elected leaders to meet basic needs. Third, support and coordinate local efforts, virtual meetups, supporting local folks self-organizing for bread, milk, medicine, direct care. Those are kind of the three ways that we're actually thinking about engaging, right? So that we're able to help the people that we reach digitally find each other in local spaces. And we're still continuing to push on issues in our time while also trying to provide some education and tools for our folks. So that was a lot. Just take a breath. And before we hear from our brilliant panelists, we are going to do a 90-second poll to get to hear more about all of you and who's on this call. So everyone will have 90 seconds to fill out the 2 questions. Vico on our staff is launching the poll right now. So I'm gonna put us on timer and go ahead and take that. But for those who might not know, part of what we use this for is frankly our own accountability. With a list so big, we wanna know where you call home, if you're a parent guardian, are you a grandparent? How old are these kids? Because it also helps us think, especially with such a well-attended webinar, where are people's actually, like, what are they coming on for? Are they coming on for information about their 2-year-old? Are they coming on from what region, etc.? And for folks who are interested in continuing to engage with some of our work, that makes sense. I see a couple notes in here. If you have kids in multiple brackets, we may have messed up on that. So just do the best you can. But definitely, I saw a couple folks popping up saying, they had 4 or 5 kids and they were in a pretty wide range. So we're doing our best I can. We're learning as we go, especially with this many people on. Okay, so we're gonna take about 30 more seconds to just wrap up on this, and then we're gonna start our panel. Okay. Yeah, and some of you, we're also seeing are writing in that you don't have kids, but you're on this because obviously you care about kids, and thank you for being here, and that is totally great as well. So I'm just gonna, because Zoom is cool like this, I'm actually just gonna, as you all are still filling in, tell you a little bit about what we're seeing real quick, also because transparent facilitator moment might help the panelists, just to kind of have a little sense of who's on the call. So 37% of you call the Northeast home, 11% the Mid-Atlantic, 14% are Southerners in the US South, 7% in the Southwest, 15 in the Midwest, 3 in Rocky Mountain, and 14 in Pacific Northwest and California. And we know, of course, that right now our regions are affected pretty differently. That might change in the next, likely will in the next few weeks, but that's where we are right now. So also giving the panelists a sense of, how far each of these regions are into precautions and measures around coronavirus. 72% of you are parents. Only 11% of you are grandparents. 2% are maybe so. Grandparents? Ooh, all right. I'm intrigued. And as a parent or guardian, the children I am raising, 22% of you said 0 to 3-year-olds, 43% of you said 4 to 10-year-olds, 19% said 11 to 16-year-olds, and 16 said 7 to 21-year-olds. So just as a reminder to all of us, that likely means that because of some of our miscalculations, there's also might be some folks that are in multiple brackets, but right now we're looking at between 0 and 10 are the 2 biggest frames. So that's also for y'all panelists. Okay, so let's get started. So the way we are gonna do this is, first, we're gonna have 2 or 3 minutes of each panelist answering the same question. That's sort of a big meta question. And then we are gonna have each of the panelists speak a little bit more into their expertise and experience. And then we'll take the final 5 minutes to invite panelists to respond. And we're gonna be doing our best to organize the questions as best we can while they're speaking. So the first and starting question is, based on where you sit, what is your wide angle view of this moment and what you see? So we're gonna go Monifa, Lina, and then Dr. Maybank, and I'll keep time for y'all. So Monifa, if you will start us out, that would be great.
Sure, absolutely. Thank you so much. Moms Rising is really excited to join our partners Women's March and to be with all of you here today. At Moms Rising, we're fighting every day to build a nation where women, mothers, and families can thrive. And during this global pandemic, we are actually accelerating our efforts to do things like promote healthcare, paid sick days, paid family leave, equal pay for women, of course, better maternal health outcomes, healthy kids, and of course, an end to mass incarceration and immigration detention. Overall, family economic security is really important always, but especially now. Today and throughout the coming days, people can visit our website at momsrising.org to find out ways to take action on all of these issues and more. From where we're sitting, there are some important pieces of legislation, and there's also some important actions that people can take. Many of you have heard about the Families First Coronavirus Response Act, which is a package of things that will do things like move paid sick days and many other things that we need. But those types of policies are informed by our personal stories. So we're also going to be collecting personal stories as the various phases of the congressional responses to coronavirus roll out. Many of you know that there was a phase one. There was a releasing of funds from the federal government to the states. And now we're really pushing for there to be some serious policies that we knew would work best always for families, but are especially needed in these moments, like paid sick days, like access to health care, like access to affordable childcare, and especially nutrition access, like SNAP and WIC and others. How is our work informed? I wanted to just talk about. It really is the experiences of everyday parents and their families. I can't stress enough to share your stories. I saw a lot of people in the chat box saying that they were nurses. I saw an ICU nurse. There are teachers in the chat box. You are the experts on the front line. Continue to share those stories and uplift those questions because they really help us shape our policy demands. The second piece that we do is we always partner with experts in the field, which is why we have Lina on and why we have Dr. Maybank on, is because we go to them regularly to say, here's what folks are saying, everyday parents and their families. You know what the issue area is on an expert level. You can help us craft what the ask is to our policymakers and to our lawmakers. So from where we're standing, a lot of you out there, a lot of parents can feel like what you're experiencing is some type of epidemic of personal failures. And as Moms Rising, we always make sure to say, no, this is actually systemic. There are problems with our systems that don't allow us many of the times to take care of our families in the ways that we need to and we want to. But we know that if we work together, we can change those systems. And that's what we're fighting to do every day. We've gotten some great news. You know, some states have gotten ahead of the curve in what they're doing to support families, to release vulnerable people from places that are harmful, like jails and detention centers. And so we want to escalate that with your help and also hear what you need specifically. So that's my view, and I'll hand it over to the other panelists.
Thank you so much, Monifa. And let's go to Lina next.
Hi, everyone. So for me, it's quite simple. You know, the wide angle view is what I see in the chat and what I see in the Q&A box. You know, this need for all of you to make the right choices for your babies. And the first thing that I want to let everybody know is that you are the experts on your children. I didn't say this originally. That's a T. Barry Brazelton quote. Please know that at the end of the day, just honor that sense of self that you have with you and your child. Get the expert advice, but then at the end of the day, it's you and your child, and that is important. Wide angle view is, you know, this is showing us where there is lack and there is lack of information. I am grateful that I'm here today, and I just kind of want to keep going so that we can get to these wonderful questions that everybody has posted for today. But it is about get information, because facts really usually take care of fear.
Great. Super helpful. Dr. Maybank, let's go to you.
Sure. Good afternoon, everyone. Definitely an honor and pleasure to be here with you on this call today, and an honor to really speak on behalf of the American Medical Association and the many physicians across the country who are part of the healthcare workforce and on the front lines working around the clock to take care of people and their families. You know, as the AMA, we do a lot to provide physician support, you know, and really be a comprehensive place where they can go to and get information, resources, updates from CDC, World Health Organization. And we've also been partnering with folks such as the American Nursing Association, knowing that they're very much on the front lines as well, and the American Hospital Association, to really, you know, come together and advocate for those resources that are in such need for our frontline workers and our patients across the country. So really honored to be here. I'm going to kind of, you know, as the health person, definitely give some health perspective as far as where we're at. You know, our latest numbers yesterday from CDC were around 3,500 cases across the country, confirmed cases. And unfortunately, you know, we've had about 63 deaths. Now, just to be very clear, and I'm sure folks have heard this, we're not sure really at this point in time of how many people really are affected and infected within this country. But we do know the numbers as the testing increases are going to increase. And as the epidemic and pandemic grows, it's also going to increase. What we are really focused on as public health and healthcare professionals at this time is slowing the spread of COVID-19. And that really means we have to put these public health measures in place, such as social distancing, that all of us have become very aware of at this time. And I think it's just really important to remember why this is. This disease and virus spreads from human to human contact. Somebody that's infected coughs and sneezes, and then somebody who's not infected, touches the droplets and potentially becomes infected. And it can also live on surfaces. So that's why we're talking a lot about cleaning surfaces and making sure that folks aren't touching their mouths and their eyes as well. And it's really important to disinfect. And so one of the big ways to kind of slow the spread of disease, and what we're learning from other countries that are definitely kind of really in the throes of the epidemic, is the importance of this social distancing to prevent and avoid spreading the infection. So the school closures that are happening across the country, after school programs are closing down, meeting spaces, restaurants, we've heard, where you only are allowed takeout and delivery. And really the recommendation of the CDC yesterday is no more than 50 people per gathering. And it's really, really important that we follow these guidelines. And they're not easy decisions, closures, they're hard, they're painful, and especially for children, as was mentioned earlier, and families who rely on schools to get meals, and parents who are working and not able to work from home. It's really a stressful time. But be very clear, if school closures are happening, because I do hear this a lot, doesn't mean that we can have play dates and parties and sleepovers and families, coming over for meals and visits. We really want to kind of, slow down on the amount of what we call non-essential activity that is happening with other people. And the other just important point that I always like to highlight is if you or your child becomes ill with mild symptoms, it's really important that you do call your healthcare provider, your physician, whomever it is, and you stay home and you treat if the illness is mild. It's really important, again, for our healthcare system, but also preventing other people from getting ill. However, if the child is short of breath, you're short of breath, then you have to seek care immediately. And so this is, the situation that we're in the country. A lot of this is really concern about the capacity of our healthcare system. We want to make sure we're able to take care of those who are critically ill and not have to get to the point of fully having to ration resources and things of that nature. And so, we're watching very closely to see what's happening as it relates to that.
Thank you, Dr. Maybank. And I want to just pass it back to you for 1 minute to ask,
Sure.
Are there any misconceptions that you feel like that are out there that are really important to correct for our audience today?
Yeah, I think, in the age of social media, which are clearly many benefits to social media, there's a lot of information out there that's just really bizarre that I've been following. I actually, just a personal note, saw my goddaughter posted something, and it was about gargling with salt water and that it was effective to get rid of COVID-19. And I asked her kindly, as a public health expert, to take it down. But that's not true. That's a myth, and that's not clear. I mean, and the clear part of it is we don't know a lot about COVID-19. We are learning a lot day by day, minute by minute, from what's happening in other countries. And there are scientists all across the world really working to find out more about the disease, but a lot to be learned. To that same point, I've heard that kids are immune, and that's not the case either. Fortunately, what we are seeing is that, and this is very preliminary data again, still a lot to be learned, that kids don't seem to get severe illness in the way that folks who are over 50 and have severe or have other complications such as heart disease, diabetes, lung disease, and those who are especially older in their 80s. So we're seeing the kids, definitely have kind of more mild illnesses and are resolving. But again, if your child has an underlying medical condition, it does put them potentially at a higher risk for a severe infection. The other thing is, I heard this the other day that, because I don't have symptoms, that means that I'm fine and I'm not going to get somebody else sick. What we're learning about COVID is that there are people who don't have symptoms almost up until 11, 14 days potentially, and they're still shedding the virus. And so it's really important to understand this is why social distancing is important. And especially, again, for our family members that are older, are above 80, are above 65, we want to make sure that we are protecting them. And, you know, it's hard for young people, you know, especially teenagers, you know, I've had friends who said they're teenagers like, well, what about malls and what about parties? Like, can we still go to those places? And, you know, there's no, you know, we have to really, you know, social distance ourselves. And two other myths that I really think are important to highlight. One is that I've heard folks say Blacks are immune. And I've heard that more than once. And just to let you know that that's not the case. COVID does not discriminate, and everyone has the opportunity per se, or the possibility of getting infected if they're exposed. The other part is related kind of to that is I've heard young people ask, you know, can I get this from Chinese food? And I think it's really important that we counter with our children and have conversations about where these fears come from, and that we also put forward a message that, you know, for our Asian presenting brothers and sisters, that, you know, it's not right to discriminate, and how hurtful that can be.
Very helpful. Thank you. Thank you very much, Dr. Maybank. That's very well noted. Lina, can we go to you? And I want to, the overall question, I also want to fill in some content there with the questions that we're seeing in the chat box. So the question for you is, how do we talk to our children about the coronavirus, you know, age appropriate responses for ages 3 to 18? And I will note that you know, the majority of folks on the poll, kids are under 10, but also I saw at least 3 questions actually getting at what Dr. Maybank was already talking about. Oh my God,
Teens.
My 18 teens,
Yeah.
what do I do with them?
Yeah.
Make sure you got that, that'd be great.
Okay, so the number one thing before you start answering any questions is to please mind your energy. Children, especially children under 5, take their safety cues from you. So the way that you speak, the way that you express the information, it is key. Your tone and your energy is very important. So the first thing, mind your tone. Now, please do not avoid questions. The questions need to be answered directly because you want to be the source of information. Children, especially children between the ages of 6 and 10, they love information. They love knowledge. So the less you answer them, the more curious they get. And you don't want the Google to be telling them anything that you haven't spoken to them about first and foremost. So all of you that have been thinking that maybe you can get away with avoiding answering any questions, which is very, very hard because a lot of them are not at school. Like in Miami-Dade, we're not in school right now. But it is important to give them your information and to give them age-appropriate information. So what do we mean about age-appropriate information? So the little tiny ones are going to ask you about specifics that they see. Maybe they've seen masks on the TV and they're going to get curious. Now, young children under 8, they like to play things out. So don't feel concerned if your little person decides to put a paper towel over their face. That's normal. They're playing it out. They're making sense of what is happening in the world around them. So you just kind of get comfortable about what toys are you going to give them for them to play this out. So maybe you do let them wear a mask, or maybe you let them play out being nurses and doctors with their teddy bears. So allow them to play. Don't avoid it. Right now, as it's top of mind, I know that there's a lot of 24-hour news and a lot of you are wanting to get information, but all of you with children under 10, please turn off the TV. Find a time where you are getting your information and your facts and your sources, because that constant 24-hour playback, and your children are listening, even the younger ones. So for the little itty bitty ones, what's most important is their routine, and not so much getting stuck on between 7 and 7:30 and between 8 and 8:30. And I've seen a lot of color grids out there, and it's well-meaning, but it's more about the patterns. You know, we wake up, we eat, we play, we go outside, we come back in. So for the little ones, it's less what you say and more how you maintain their routine and their patterns. For children 8 through 12, don't get ahead of them. When they ask you a question and you get stuck and you feel like a deer in headlights, just look at them and go, you know, that's a really interesting question. What made you ask me this? I want you to ask them that second question, because you may end up giving them adult information that they weren't really asking. So whenever they ask you something and your heart gets in your throat and you're like, I don't know what to say, just say to them, hey, that's interesting. Tell me more. What made you ask me this? And when you clarify, then you'll be able to answer the question in a better way. Be reassuring. Tell them what you are doing. What are we doing to stay healthy? There was a mama in here that asked a question about, you know, what do I tell my little one why she isn't going to preschool? What do I tell my school age one and why they aren't going to school? What's practical? 6 and under, keep it simple. We're trying to keep everybody in our community healthy, especially, you know, Nana and Auntie. So the best thing that we can do is to spend time in our home so that we can all stay healthy and safe. And then go down the list of the things that you're doing to stay healthy and safe. You're washing your hands, you're cleaning surfaces. Little ones, especially children under 7, they'll be happy to grab a broom and walk around the house with you and clean. So tell them what you are proactively doing to stay healthy and safe. A lot of you are getting stuck in answering the question because of your own fear. And this is very important for all of you that have teenagers. This is specifically to those of you that have children 10 and up, 12 and up. 12 is teenagers, believe it or not. We have become anxious about being anxious. And anxiety is a natural human response, and it's appropriate to be scared and anxious right now. So for children 12 and up, since we have put it in their heads that stress and anxiety is bad, it's not. Allow them to understand that it's perfectly healthy if they are feeling anxious and scared, but let's think about proactively what we can do to honor and accept that we're feeling this way. We don't have to wallow in it. We just have to accept it and then move forward. Now, a lot of you ask questions about the adolescents, about them wanting to break what Dr. Maybank is telling us not to break, which is the social isolation, right? To go be with their friends. And I could hear it, right? I have a 14-year-old at home, right? Well, what about if I'm in the backyard and I could be 3 feet away? Because they're beautiful. Adolescents are awesome at problem solving and debating with you, and that beautiful brain of theirs is constantly in this beautiful debate. Look at them and say, nobody, but definitely let's set up a Zoom and let's make sure that you're talking to your friends, because that's really important right now. So allow them to get on their screen and to talk to their friends and help them set up a Zoom, just like we've done right now. You know, I literally this morning walked into my daughter's room and was like, have you talked to your friends? Why aren't you talking to your friends? You're supposed to talk to your friends. Tell your friends that you have the crazy psychotherapist mother that wants all of you to talk at least 1 hour every day for the rest of this time. So know that for the adolescents, please protect their social time. Let me think about other questions that I've seen. I saw some of you that are healthcare workers. You asked a very difficult question, and I wanna answer that question directly. You said, I can't promise my child that I'm going to be okay. And I don't want you to do that either. And I love that, I think it was somebody by the name of Kimberly asked that question. No, don't ever promise your children something that you cannot keep. So for you, you also have to let them know that it's okay to be scared, that your job is to keep the community and the people in the world healthy. and then walk them through the things that you're going to do to stay safe while you're at the hospital. Let them know, what you're going to wear in your hands, and about, the screen that's over your face, and that you're going to do your hardest to keep them safe. And then let them know who are they going to be with for them to be safe while they're at home, while you're at the hospital. But of all of you that have asked questions, those of you in the healthcare field, this is incredibly difficult. And I'm grateful that you're being mindful, that you don't want to promise anything to your children, that you cannot keep. So little ones, let them play, maintain their routine. School-age children, answer all of their questions. When you get stuck, stop and go, that's interesting. What made you think that? So that they can, be clear on what they're actually asking, and your adult brain doesn't get in the way. And with the teenagers, tell them absolutely not. We're not gonna go and become vectors of viruses. However, let me make it easy for you to be with your friend. Let's set up the Zoom, and let's get all your friends and, get on the video, and, let them play on the Xbox. Let them have that moment of connection. They do this virtual world a lot better than all of us.
I would also add to the healthcare worker piece, because I think you're absolutely right, and it's expressed in the questions that have that we're seeing kind of elevate, is that there is now definite recognition of the toll and fatigue that many of you are probably experiencing at this time, and having all these decisions that you have to make, not only in the workplace, but also when you come home, and a desire to want to protect. And some folks have to stay home, and they're healthcare workers, and they feel guilty as well. And so we have definitely worked to try to provide resources around that space at the American Medical Association. And soon enough, we won't have it yet, but we can definitely make sure that the Women's March has the information, and we should have some information on just who do you go to talk to kind of deal and cope and manage through all of this, because we definitely see you all on the front line, and it's not easy. And then just another point about children from the health context, and just remember that children still need to exercise no matter what age they are. The opportunity is clearly in the home, but it's okay to go outside. We just don't want you around a lot of people at any given time. So, I saw some folks talked about, they went around the neighborhood and did walks, to the park. But do be careful with some of the playground structures, just so that because they can also kind of hold virus a little longer. But we do encourage you to go outside and to experience, the fresh air if you're able to across the country.
I want to address one question that I just saw, that there's a little 6-year-old that she doesn't know how to tell her friends about social distancing. Just let those little tiny people know to say, I am making a decision to take care of my community. It's a beautiful opportunity to, children love to be helpful. Children love to love. Let them know that we are doing a loving decision by staying separate from one another, so that this little germ doesn't have to transfer from one person to another. So be on the side, give them the information of how they are being of service, and how they are being part of an advocate, of a community member, of doing good in the world. And so for this little 6-year-old, tell her to tell her friends and family that she's doing a good thing for her community and staying away from other people, so everyone can stay healthy. And then there was another question from a parent of a teenager that works, and the parent feels uncomfortable with their teenager, going into work because she can't trust what the work environment is doing. I would walk your teenager through calling her work and wondering with her work, what's the safety there? However, we are being asked to socially isolate. So Dr. Maybank, what would you say? Because I would want you to have your teenager call her boss and be like, hi, I have some questions about how you're going to keep me safe. However, Dr. Maybank, what would you say?
Yeah, I would agree. She needs to call her boss first. I think that's absolutely true. Mhm.
Yeah, and allowing your teenager to take on that responsibility of
Yep.
saying, advocating for herself and saying, I know that I have this job and I know that I have this responsibility, but I also have heard about social isolating, so I want to understand what's happening in our work setting. That could be a very good opportunity for your adolescent to learn self-advocacy.
Yeah, this is excellent. And I think we've done an excellent job. The panelists are doing an excellent job of bringing in the questions as we're being asked. And I want to turn now to Monifa to talk a little bit about how to be a strong advocate for children in your life and in your town. And I would say one reflection as somebody who's been doing advocacy and organizing for a long time, I know there's a lot of questions on here about anxiety. And I would say, just as an I statement, doing things for the community, whether that's digitally or in person, so often has actually been part of what's helpful for me. And so I'm also interested in hearing from Monifa about how these pieces all intersect.
Yes, absolutely. I just want to say that Lina and Dr. Maybank are rock stars, and I see all the positive comments, and that's why we work with them so regularly. I saw one question about this advocacy piece. I mentioned earlier this bipartisan Families First Coronavirus Response Act, and some people wanted to know, what is it? What does it do? So just quickly, one of the things that we and partners all over the country are calling for, and that you can join the call for, is for there to be free coronavirus testing for everyone who needs it, including those without health coverage. The second piece is paid emergency leave with both 14 days of immediate available paid sick days to use during the public health emergencies, but up to 3 months of paid family and medical leave, which is really important. Strong food security initiatives, making sure that SNAP, that I mentioned earlier, WIC, student meals, meals in childcare settings, senior nutrition meals, people with disabilities, and food banks are ready and stocked up and supported by our federal government to be prepared for when people need them. Badly needed increased federal funding for Medicaid. We, of course, using this opportunity and for you to join us to push for that. And also, last but not least, necessary funding for states to prepare for increased unemployment insurance caseloads. I'm in New York City. Yesterday, all restaurants and bars and cafes closed down. And so a lot of people, wage workers, people who rely on tips, our weekly paycheck will really be hit hard. So we want to make sure that that system I talked about earlier is prepared. I wanted to talk about that quickly because I actually wanted to ask Lina another question, who laid out so elegantly what to do with kind of like these children up to 18. But I saw some questions in there, and I have some too about these older teenagers and the influx of the college students that have come home. They are so sad.
Yeah.
Our seniors, class of 2020, all of them are like, my prom, my graduation. You know, so I just wanted to throw that out there because I did see a few parents with the older children wanting to know, because they can almost be the toughest crowd around social distancing.
Definitely. I think so. I think this is true for our young adults, but it's also true for all of us. Okay, all of us came into this pandemic situation with 2 to 3 pots boiling of emotional and life stuff, right? And now we're going to add the pandemic and then the financial and then the political, and now we have 6 pots, right? So the first thing that I am telling everyone here and all of my clients is, please accept that this is hard. Denying or acting as if this isn't sad or this isn't scary or this isn't unusual is what's actually driving you crazy, right? Sucking it up is not necessary right now. It's important to tell yourself, to tell a senior in high school or a senior in college, I'm so sorry, baby, this is not fair and it is sad. And then sit in the dark with your human for a little bit. It's okay. We are stuck in this mentality in our society that feeling these hard feelings, it's wrong or weak or less than, when actually it's a 90-second synapse in the brain. It's really quick. It's really fast. There's a wave behind me. You know, I kind of purposely sat in front of it because I wanted to make this, you know, feelings come and go. And we are in the midst of uncertainty. And in uncertainty, our feelings will pop up and they will calm down. So it is very, very important to first and foremost, look at your young adult, look at yourself and say, I'm scared, right? And then take a deep breath and do what's in front of you. This is not a time to make long-term decisions or change your long-term belief systems. This is not the time for that. This is a time to do the next indicated thing, right? So with the young adults, tell them it's true, it's not fair, you know, hashtag sit in the dark with them for a little bit, and then think about what they can do now to be social with their friends, that is safe, that keeps you healthy. Because, you know, some of us, you know, those of you that have 20, 22-year-olds, you're 40, you're 50, some of you are 60, they need to, this is an opportunity to teach our community about being a community. And I want all the parents of young adults to talk about the importance of the responsibility that we have as a community, but also sit in the dark with them and allow yourself, whatever feeling bubbles up. Okay, you don't have to wallow in it. You don't have to say, why me? Why? But something as simple as saying, I am sad, will decrease that emotional moment. So, you know, it is very, very sad that some of these seniors, you know, don't get to have their last semester of college. It's just, and it is. And then that's how I would handle it. And there's another question about, how do you know how a 3-year-old is feeling? How do you get them to tell you? They show you. If a little tiny 3-year-old or a little tiny 2-year-old or a 4-year-old gets very, very anxious, challenging behavior will begin. They will have a hard time sleeping. They will have a hard time eating things that they generally do. They just get a little more prickly. So you don't have to ask them, are you sad? Are you sad? Are you sad? They actually don't know. You could label it. You could say, oh, everything is really, really different right now, buddy. And that's why you're feeling so yucky. You're usually at school with your friends, but come, mom, I'll give you a hug. And then put them down and set them on their way, right? But be okay with your children not being okay, especially the little tiny ones, because their little worlds just got turned upside down, and they like to kind of, you know, do things that they can predict.
So helpful. Again, there were very few questions that you all didn't actually weave in as you were watching answering them. One really specific one, Dr. Maybank, was folks were asking about additional safety precautions for those who live in apartments, having to do with elevators, and also beaches and camping, if you have any advice on those things for folks.
Yes, I think, you know, the advice really follows the same. You know, we're recommending the social distancing. We don't want you in crowds of 50 people or more, definitely. So I saw pictures today of, I think it's one of the beaches in Miami, and there were lots of people out there, and we don't want that, and we really need to stay away. If there are, you know, 4 or 5 people on the beach and it's a really spread out beach, then possibly fine. But for the most part, we don't want folks, excuse me, in those types of crowds. And the same thing goes for camping. Though I think what's nice is that I know I've heard some folks do hiking, you know, and go to camps. I think it's fine. It's just dependent on how many people are there. And we really still at the same time want to do our best to kind of stay, you know, in our kind of local communities that, you know, aren't always exposing others to ourselves, and we're not exposing ourselves to others potentially. It's really critical at this point in time, the kind of limited amount of movement that we can have. And I forgot the first part of the question that you asked.
Safety in apartments, Dr. Maybank.
Apartments, yes. And so, you know, in places, you know, in some of the major cities, you know, that's our lives, right? We're fortunate that some of the buildings have kind of taken precautions and have actually put up hand sanitizer when you come in the door and by the elevator. So highly recommend that you use the hand sanitizer as you come into the building, you leave the building, you get on the elevators. I also, and this is just me, I just don't touch the buttons. I kind of pull out my sleeve and touch, the button with my sleeve or open the door with my sleeve. So I'm not touching the handles as much because you aren't necessarily going to have something around you that you're going to be able to wipe every single moment. And that's how, we've been managing in here. And that's kind of my recommendation. I also just wanted to really elevate, it's kind of been brought up in different ways. And I do see some of the questions, some of the moms who are single moms, really trying to figure out how to manage this. And I think this can impact older children too. If they see their friends not having the same experience and opportunities, they may feel guilty. And I'm sure there are ways that Lina has in terms of like, how do they feel, deal with that guilt of when they see potentially their friends just, struggling through this time because their parents aren't home. But I really want to elevate that, there are ways that we can think about, being in solidarity with the folks who are, Black and Brown communities that sometimes also experience lower wealth in their areas, also a tremendous lack of trust for the medical system. And so I think it's really important that we come together as communities and really encourage each other to listen, but also to listen to our health professionals at this time and really take it seriously. For the elderly and those with chronic conditions, as well as those who are differently abled and have disabilities, it's a really vulnerable time for them, as was mentioned before. And there's a lot of uncertainty, and and many young people have elders in their family or folks that they know that are just have been made more vulnerable by society. So encourage them to call and have conversations with them via phone or via Skype or via whichever way, and then recognize that they have a hard time, getting around as well. And sometimes there are things that we can do that still keep us at distance, that still allows us to support. I did just learn of the CDC website, the Centers for Disease Control, has some guidance up on, like, in your neighborhood, how to create a buddy system in the context of social distancing. So just something to kind of take a look at if you see that as well. And I think also just kind of from an advocacy kind of political civic engagement point of view, the census is coming up and it's here. And I think, we show solidarity by making sure that we are counted. And as Monifa said earlier, we're uplifting those stories, but we're also uplifting our lives and our context. There are many people who, understandably so, fear to be connected to the system in any kind of way. And we understand that, but it's really important. And I think this time really demonstrates it, that we do have to be politically and civically active. There's so many political determinants and civic determinants of health that really, dictate the resources that we get in communities across the country.
It's extremely helpful. We're coming to the end of our time. We tried to get to many questions. I think the panelists did a valiant job. Want to give you a few pieces of information. One, many of you asked if this is being recorded. The answer again is yes. For folks who may not have heard it before, we are going to send the recording out with links to the resources shared by our panelists and many of you today to folks who RSVP'd for this. And as well as those of you who attended, if you want to share it, it's a resource. We want it out there with whoever it's helpful for. Secondly, yep, it looks like we're seeing it right here, if you can see it on the screen, moving it around in real time. Secondly, I just want to name that and underscore that there was only one question I would deign to have any opinion on that went in the chat box today, and that is, what do you talk about when asked if our government's trustworthy? And the only thing I would say that I've always said to every child in my life, to every person in my life as a community organizer, really echoes some of what Dr. Maybank was saying, which is that, like, we make it more trustworthy and accountable when we're willing to come together and actually push for what we need and continue to be civically engaged, continuing to speak up even digitally and online for what we believe is important and for the better good of everybody. We also want to highlight that I think it's really important from a political point of view, what Dr. Maybank brought up is that there are huge disparities in healthcare. There are reasons why different communities actually have different relationships to healthcare systems, and we want to continue to encourage people in their local communities to consider actually how to engage and in support of those who are most vulnerable in our medical system. And I think many of them were named already: people of color, poor folks, people with disabilities. My community, the LGBTQ community, is also one that experienced a lot of discrimination, is very afraid to go to the doctor often, right? We can encourage the people in our lives who are directly affected. Borrowing from Lina, yes, it is true. All the historical harm is true, and how to help the people in our lives get what they need in this moment, right? And then finally, you know, I just want to say that I think gratitude is something that we can do right now. We can provide gratitude. It doesn't cost us anything, and scientifically, it actually also makes us feel better from a very pragmatic point of view. Gratitude for all of the people who are on the front lines of taking care of us in our families, in our communities. And I also just want to say, you know, please join me with silently sending some energy of appreciation and gratitude, not just for these 3 panelists today, but for all the work that they're doing that we know nothing about. I'm sure some of it very much around the clock. And I also want to give a really special thank you for MomsRising. This would actually not have come together without you all. And we want to continue to lift up and share also your recommendations about campaigns and needs and the best way forward, because you're such a trusted expert partner in this. So much appreciation. Thank you everyone for being with us, and we'll be following up soon. And please take care of yourself and your families and communities.
Thank you. I'm honored to have been here.
Yes,
Thank you.
Take
We'll
care.
send something out to all the RSVPs. Thank you.
Yeah, thank you.
Thank you.